Still ahead, both Bruce Willis and Wendy Williams have it, but do you?
What are the warning signs of frontotemporal dementia and aphasia? Neuroradiologist Dr.Suzie Bash joins us next with those answers.
Well, he recently heard the terms frontotemporal dementia and aphasia after TV personality Wendy Williams and actor Bruce Willis were both diagnosed within a short time of one another.
But what does this diagnosis mean, and what are the symptoms, and who is at risk? To answer these questions and more, we've invited neuroradiologist Dr. Suzie Bash. She's one of the medical directors at RadNet. Good to see you.
Thank you for having me.
Yeah, so much. Just, a lot of us had never even heard of some of this prior to it being in the news. What is frontotemporal dementia, and what does it mean?
So broadly speaking, that term dementia describes degenerative changes in the brain that can impair intellectual function, and severely enough that it can affect your activities of daily living. And so what happens is those neurons or brain cells will eventually die and cause the brain volume to decrease. Now, dementia is a huge health population issue. In fact, 1 in 3 of our seniors will die of dementia. And there are different types of dementia. So we hear most probably about Alzheimer's dementia. So 6.7 million Americans are suffering from Alzheimer's dementia. But there are other kinds. There's vascular dementia, dementia with Lewy bodies, and frontotemporal dementia. Now, frontotemporal dementia is more rare. That affects 55,000 Americans. But even though it's more rare than Alzheimer's disease, it's actually the most common dementia in younger adults, so between the ages of 40 and 65. And so frontotemporal dementia, as the name implies, affects primarily the frontal lobes and the temporal lobes of the brain. There are 4 lobes of the brain, but it primarily affects these 2. And because of the location, the primary clinical symptoms are behavioral changes, personality changes, and language difficulties. Now, there are 2 main subtypes of frontotemporal dementia. One is called behavioral variant, and that manifests primarily as personality and behavioral changes first. But the other is primary progressive aphasia, and that's really a problem with language. Now, usually the left side of the brain controls language, not in everybody, but in most people. So that side of the brain is affected, and patients that have primary progressive aphasia will have difficulty with speech and reading, writing, and understanding conversations, and also difficulty with recalling the names of objects and the names of people. And so both Wendy Williams and Bruce Willis and their caretakers and families have come forward with this diagnosis, and I just want to take a moment to commend them for having the courage to publicly disclose this, because it really can increase awareness for the thousands of people that are impacted by dementia.
We always see, eat this kind of food, it's a brain food, or take this supplement. Is there anything you can do to stop this or slow it?
Yeah, so for the different dementias, there's often can be a genetic component, or it can just be sporadic. Now, there are things like for Alzheimer's dementia that can be helpful, but for frontotemporal dementia, it's, both of them are progressive, degenerative disorders. But there's not really a lot you can do to prevent a frontotemporal dementia, and in particular, the primary progressive aphasia, which is a subtype of that frontotemporal dementia. Unfortunately, there's just not much that you can do to prevent that.
And is there a survival rate on this?
Well, frontotemporal dementia tends to progress more rapidly than Alzheimer's, and so on average, after diagnosis, the survival is typically about 6 to 8 years.
Oh, okay.
Any treatments at all? I mean,
Well, there's no cure for either frontotemporal dementia or Alzheimer's, unfortunately. Now, we hear a lot about Alzheimer's in the media because there's now disease-modifying therapy that now has regulatory approval. And new sub-study analysis has shown that that actually decreases the rate of cognitive decline by 76% and also can improve cognitive function by 60% for Alzheimer's disease. But unfortunately, there isn't a disease-modifying therapy available yet for frontotemporal dementia. And you can't use the same drug for Alzheimer's with frontotemporal dementia, because the drug for Alzheimer's is targeting a certain sort of toxic protein called beta amyloid that isn't really a feature of frontotemporal dementia. But that doesn't mean that there aren't some hopeful things. So number one, there's research ongoing. Number two, you can treat the symptoms of the disease. Like if you have depression, you can treat that with medication, or if you have anxiety or agitation or impulsivity, all those can be treated with medication. You can see a speech and language therapist that can help you with mitigate the language difficulties. And it's also important for planning for loved ones and caretakers to make sure that the patient is safe and secure, that their resources are protected, and that all of their needs are being met. So it's, you know, there are things that can be done, but unfortunately not a cure.
Thank you so much for clarifying some of it for us. We appreciate it. All right, thank you. And you can contact Dr. Bash at radnet.com. Also follow everybody on social media, RadNet Imaging. And now let's check in with Kai.